Hey everyone, welcome back. Today I'm going to be taking you through the 3 common blood tests you'll do for every patient that comes into an emergency or a trauma center, so let's get right into it. So the 3 tests you're going to do for every patient that presents to you in emergency or an acute setting is the urine electrolytes, the full blood count, and the blood gas. Now we have a video going through the analysis of the blood gas, so I'll put a link to that down in the description, you can check that out. And today we're going to be going through the UNE and the full blood count. So when someone asks you to take a UNE and an FBC and you have to fill it in on a form, there's a little thing for FBC, but there's no actual slot for UNE. So what are the actual tests you have to do? Well, it's sodium, potassium, urea, and creatinine. Those are the 4 tests that usually make up a UNE. So to take a UNE, you're going to take your syringe, draw up some blood, and you're going to put that into a yellow top tube. Bear in mind, different centers may have different tubes that they want you to put specimens in, but in South Africa, the standard is yellow top tube for a UNE. For a full blood count, you're going to take a purple top tube. Because these 2 tubes have different chemicals inside them, so for doing different tests, each one is suitable for something different. So, you've taken your blood, you've put it in a yellow top tube, and now you need to actually order your UNE. So you take sodium, potassium, urea, and creatinine. So for the sodium, you want the sodium result to be between 136 and 145 millimoles per liter. If it's too low, your patient has a hyponatremia. And that could either be because they're not taking in enough sodium, or because they're excreting too much. And conversely, if they've got a hypernatremia, so more than 145 millimoles per liter, that could be because they're taking in too much, or they're not excreting enough. Remember, the overall value of a UNE is to check the kidney function of the patient. And that's what you're looking for here. So potassium needs to be between 3.5 and 5.1 millimoles per liter. Too low, you've got a hypokalemia. Too high, you've got a hyperkalemia. Remember, with potassium correction, whether it's too low or too high, you need to correct potassium slowly, because changing potassium fast, whether increasing it or decreasing it, can cause cardiac arrhythmias, and you need to be careful of that. Next, you've got urea. Now, urea needs to be between 2.1 and 7.1 millimoles per liter. You're concerned here if your patient has a urea level that is too high, that they're not excreting urea efficiently, so there could be some sort of problem in the kidneys. And the last 2 things you measure are creatinine and your GFR, your glomerular filtration rate. Creatinine needs to be between 64 and 104. Remember that patients with bigger bulls will naturally have more creatinine than patients with smaller bulls, because creatinine is released by the muscles, so bigger frame, more creatinine released. However, if your creatinine is over 104, that usually means there's some sort of issue with creatinine excretion, and you need to do more tests to check that out. And the last thing you measure on a UNE is your estimated glomerular filtration rate. Now, you define that as either being more than 60, in which case they don't measure it further than that, because more than 60 your glomerulus is doing okay, and less than 60. If it's less than 60, they'll usually give you some sort of rate, and at that point you know that there's some sort of dysfunction in the kidney and you need to do further tests. Now, once you've done the UNE, the next thing you're going to do is the full blood count. Now, the full blood count gives you information on things like your white cell count, your red cell count, hemoglobin, your mean cell volume, and your platelets. So it tells you how much of each cell you've got. Now, your white cell count needs to be between 3.92 and 10.4. And this is 3.92 to 10.4 billion white cells per liter. So if your white cell count is low, it usually means that you've got some sort of dysfunction in your white cell production, or that something has been depleting your white cells. If it's too high, it's usually a marker of inflammation or infection, so that's what that points to. Your red cell count is not as important in your FBC. What is important is your hemoglobin count. That needs to be between 13 and 17 grams per deciliter. If your hemoglobin is too low, you could have an anemia. If it's over 17, your patient may have a polycythemia. Either way, you need to investigate. And going hand in hand with hemoglobin is the MCV, the mean cell volume. Now, your MCV needs to be between 83.1 or 101.6 to be normal. Now, the reason this is important is particularly in anemia, there is diagnostic value in whether your red cells are small, normal, or large. So if it's below 83.1, that's a microcytic anemia. If it's between 83.1 and 101.6, that's a normocytic anemia. and if it's higher than 101.6, that's a macrocytic anemia. And that's important because there are different diagnostic paths that you go down for each size of red cell. So a microcytic anemia will have different causes than a macrocytic anemia, which is why mean cell volume is important, particularly in the context of anemia. And the last thing you're going to check on a full blood count is your platelet count, how well your patient is clotting. Normal platelet count is between 171 and 388. Now if it's too low, your patient may have trouble clotting, they may have something depleting their platelets. While if it's too high, over 388, they may be in a hypercoagulable state, and that's something that you need to be aware of so that your patient doesn't start throwing clots. And that's it for the full blood count. Now, like I said, the third test is the blood gas. We've got a video already describing how to interpret the blood gas and how to take it, so you can check that out next. But that's it for the 3 tests that you would do for every patient that comes into emergency. Now, if you liked the video, make sure you leave a like, leave a comment down below telling me what it is you'd like me to cover in the future, and make sure to subscribe for more medical student content knowledge and practical tips. Thanks everyone, see you next time.